This conference will now be recorded.
Hello, everyone. Hello, dear. Hello, Dr. Yelin and Dr. Adi, Dr. Shitan, Dr. Hiba, and Dr. Jalika, Dr. Jihad, and Dr. Mariam, Dr. Shahd, and everyone. You're welcome to the discussion. Thank you very much for attending in this critical time. Okay. Hello. Okay. So, guys, I'm not going to waste your time. That will be very quick. So I want to revise with you some tips that's important for your exam from the prenatal and maternal mortality report, okay, which is published in November 2022. So this is the latest one for you guys. The information in this MBRRACE actually very interesting. It doesn't change so much from the previous ones. However, the common questions are common, okay? So, my champions, before your exam, okay, you will need to have a look, okay, to those facts. First of all, you can have an MQ. This MQ asking you about, he will give you a definition and ask you what is the meaning of that. Is that early direct death, late direct death? This is early indirect, this is late direct, or whatever, okay? I don't want you to panic, my friends, okay? What I need you to know is that how many deaths that we have in the classification of the maternal deaths. Okay, I just you want to remember that we have four. How many? Four. Okay, what are the four? We classify the maternal death into direct deaths, and the direct deaths, this is any pregnancy complication that lead to this, okay, during the pregnancy period and up to how many weeks postpartum? My brilliant champions, we speak about up to 6 weeks, okay, which makes how many days? Because of the definition we need to remember, yes, exactly, that's a 42. Okay, so direct, like thrombosis. Thrombosis is a complication of pregnancy. So if you remember the antenatal care problems, like for example, the VTE, the pulmonary embolism, the hypertension in pregnancy, I mean the preeclampsia, okay? So this is, we speak about a direct cause of death, something that happened because of the pregnancy and led to death, okay? So this is thrombosis and the thromboembolism continue to be the leading cause of direct death that occur during the pregnancy or within 42 days of the end of the pregnancy. Okay, okay, so how about the indirect cause? Indirect cause, this is a pre-existing condition, okay, and it gets worse by the pregnancy that lead to death. So again, it's in the same time within the pregnancy and 42 days, right? So death due to indirect cause, this compromise just over half, 52% of the direct and indirect maternal death. So the question comes and say, what is the most common cause of indirect maternal death? And the answer will be the cardiac disease. Cardiac disease remain, okay, on the top. So indirect is the most common cause of disease. If we speak about direct or indirect, so you will go for indirect causes. In between the conditions that's indirect that cause death, cardiac disease is the leading cause of indirect maternal deaths. Okay, there is another question that's very famous as well, asking you, among these cardiac condition, which one is the commonest cause of death according to the latest MBRRACE? So, dear champion, what would be the answer? Which condition? Is it MI in pregnancy? Is it valvular heart disease? Is it cardiomyopathy? What do you think? From the same reports, we have the numbers here as the myocardial disease and cardiomyopathy accounts to 25%. Okay, so this is the common cause, okay, of the cardiac disease that lead to death according to the latest MBRRACE. One of you have studied the maternal collapse guideline, and he will tell me, doctor, there something about ischemic heart disease. Yes, I'll tell you, dear. Okay, this was at the time of the publication of the guideline. This was based on the 2016 report, okay, where at that time the ischemic heart disease was the commonest. But now, according to the latest MBRRACE, okay, it's the myocardial disease and cardiomyopathy. Okay, guys? Clear so far, my friends? Myocardial disease and cardiomyopathy. Okay, so this is some questions that came already in the exam, as I told you, can come as MQ, asking you about which uh, condition is this blah 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 commonest cardiac or the commonest direct cause of death or indirect cause of death, and sometimes here we give you the definition, those two lines, and ask you what is the meaning of that. Okay, so direct is, again, we don't have early and late, it's only direct, and this is up to how many days after the pregnancy, okay, up to 42 days. Indirect is it a condition that the pre-existing condition that get worse during the pregnancy and the same period also of the 42 days post pregnancy. Okay, after that, after the 42 days, any death can happen, we call it as late death. Late death. So is it late direct, late indirect after 42 days, or only late? Only late. Okay, guys? So only late death is there. So if I ask you a question, what is the most common cause of death, okay, of the maternal deaths that happen between the 6 weeks of pregnancy and 1 year after the end of pregnancy? What do you think the commonest condition? It's a suicide. Excellent. Okay, it's a suicide. So, other conditions that might cause confusion to the candidates, that in between malignancies, we do have direct malignancies, we do have indirect malignancies, we do have something like coincidental. Okay, like what? I'll tell you. Direct malignancy means direct, it's something that came up because of the pregnancy. If the woman is not pregnant, she will not get this disease. Like, for example, the choriocarcinoma. And here I speak about the choriocarcinoma as a disease of the, the GTD, okay, and it turned into cancer, so it caused GTN and so. Okay, so I'm not speaking here about, for example, okay, a woman who never get pregnant and she developed the ovarian tumor, and by the histopathology they discovered that this is a choriocarcinoma. No, no, no. I speak about the one that came from the GTN, okay, that related to the pregnancy. Okay, so this is choriocarcinoma that's related to the pregnancy or comes as a pregnancy complication, is called a direct malignancy. Okay, how about indirect malignancies? Indirect malignancies like breast, ovary, and cervix. Breast, ovary, and cervix, those called indirect malignancy. There was a question, I think it was September 2022 exam, asking about osteocarcinoma. Okay, So what do you think, osteocarcinoma? Is it something that get worse by the pregnancy? A woman who died from osteocarcinoma, I think 6 months or something after the pregnancy. No, this is a coincidental, okay? So breast, cervix, ovary are indirect. Choriocarcinoma, pregnancy related, direct malignancies, okay? Okay. How about sepsis? Sepsis also, they like to ask it in the exam. They will give you a condition like a woman who died from infection post abortion, surgical abortion. Okay, so the infection led to sepsis, led to death, and what was the cause of the infection? It was post-abortion. So is it direct or indirect death? Anything that related to the pregnancy or the genital tract is direct sepsis. Okay, give me more examples. UTI, direct or indirect? What do you think? Direct. Okay, a woman got a prolonged rupture of membrane. Okay, and then after that developed sepsis and she died. What type of death is that? Direct. Excellent. Okay, a woman got COVID-19 during pregnancy and she died from the COVID-19 sepsis. Indirect. Okay, a woman got pneumonia. Indirect. A woman got influenza, like the swine flu, for example. That's indirect. Okay, so sepsis can be direct or indirect. Yes. Malignancy can be direct or indirect. Yes. Psychiatric disorders can be direct or indirect. Yes, they can. Like what? I'll tell you. We all agree that suicide is direct cause of death, isn't it? Yes. Okay. So a pregnant woman, she got severe depression, okay, and after that she committed suicide. This is direct psychiatric. A woman who was a drug addict, okay, while pregnancy, and she had overdose and she died. What is this? This is indirect psychiatric disorder. Okay, guys? So direct like suicide, indirect like alcohol intake, like drug misuse. Okay? Is that clear, my friends? Okay, so I give you a slide, okay, just to have a look if you are interested, okay, that to see down there how they classify the deaths, okay, between it is direct or indirect, and here they have a notes for the indirect malignancies, for the suicide as a direct, okay, cause of death, or the other indirect psychiatric causes like the drug and alcohol, okay. So this is written there, and it's by the MBRRACE. Okay, this is the comparison, okay, for the maternal mortality rate per 100,000 maternities. And please remember, they count this report per how many maternities per 100,000 maternity. Okay, and here is the latest one. Okay, and this is, as I told you, there is no much difference, okay, between. Remember that they classify all the deaths, okay, up to 42 days after pregnancy into direct or indirect. After that, this is called a late deaths. Anything that not related to the pregnancy, like for example, a woman had a car accident, This is called a coincidental, okay? Somebody killed his pregnant wife. This is called a coincidental, okay? Those are exam questions, my friends, asking you about accident, okay, or about homicides, okay? This is under the coincidental. So they classified this again into 4 categories: direct, indirect, up to 42 days after the pregnancy, and after that late, anything, okay, that's called a coincidental. Okay, so this is the table where I give you, okay, my tips as far as I remember from the recall questions. I have collected this one. They ask about what is the most common cause of deaths among these, and they give you indirect cause. This can be a single best answer question. As I told you, late or early, no, it's called only indirect, okay? And most common indirect, okay, is the cardiac disease. Among the cardiac disease is the myocardial problems and the cardiomyopathy. Okay, this is according to the latest MBRRACE. Most common direct cause of this is thrombosis, okay, the VTE, and the most common up to 1 year after the pregnancy is the psychiatric disorder suicide. Okay, and another question that actually very famous that ask you what is the most common cause of cardiac arrest. What do you think, guys? Hemorrhage, eclampsia, pulmonary embolism, hemorrhage. Okay, it's hemorrhage. Okay, my friends, so hopefully that you remember that. And I would like to remind you again, okay, by this obstetric cardiac arrest, because it is published, okay, by the MBRRACE UK. They published this one, okay, as mandatory training, okay, for all obstetrician and all the people who work in the obstetric, okay, in order trying to reduce the rate of the cardiac arrest. So here he give you the books of the 4H and 4T's causes of the cardiac arrest, okay, and remember it's hemorrhage the most common one, okay, and here they give you the stepwise approach, okay, for the management, okay. So confirm a cardiac arrest, call for help, declare that this is obstetric cardiac arrest, and a team for mother and team of the neonate if the neonate is more than 20 weeks. All what you need, okay, in the resuscitation: make sure that the woman lie flat, apply manual uterine displacement or left lateral tilt, and this is from 15 to 30 on a firm surface. Commence a CPR and request a cardiac arrest trolley, and after that standard CPR ratio and hand position will apply. Evaluate the potential causes, okay, and identify the team leader, allocate the role, and then apply the defibrillation pad once it's arrived or it is now reachable to you, and check the cardiac rhythm. Okay, remember that defibrillation is safe in pregnancy and there is no change to standard shock energies are required. If it is VF or pulseless VTAC, then defibrillation and first adrenaline and amiodarone after the third shock. This is an MQ, okay, from recent exam. So what is the first medication will be given in the resuscitation or during the resuscitation? In cases if it is VF or pulseless VTAC, give the shock, the defibrillation, and then start the medication. What medication? It's adrenaline, okay? During the resuscitation, you will give adrenaline as IV or IM. IV, okay? 1 mg IV every 3 to 5 minutes in non-chewable or after the third shock if needed. Okay, so adrenaline. If PEA or asystole, then resume the CPR and give first adrenaline immediately. Check rhythm and pulse every 2 minutes. Repeat adrenaline every 3 to 5 minutes. Okay, guys? Okay. Maintain airway and ventilation. Give 100% oxygen using the bag valve mask device. Insert the supraglottic airway with drain port or tracheal tube if trained to do so. Okay, remember that intubation will be difficult in pregnancy, in pregnant women, and the airway pressure may be higher. Apply waveform, capnography, and monitor to airway. If expired CO2 is absent, presume esophageal intubation until absolutely excluded. Okay, they asked in the exam about the rate of CPR. They asked in the exam before about what is the first medication to give and what is the route to give this first medication during cardiac arrest cases. And they asked about what you would give after the third shock in case of VF or pulseless VTAC. Okay, guys? So please take care. This is in the number 5 here. Please make sure that airway is maintained. Make sure that the circulation also is maintained, okay? And the rule of the emergency hysterotomy or the premortem cesarean section, this is if the pregnancy 20 weeks or above, and this is to improve the maternal outcome, and you don't need to move the patient or anything, you will do it in place, okay? And then you need to finish that within 5 minutes, okay? Guys, remember that post-resuscitation from hemorrhage, okay? And you need to activate the massive hemorrhage protocol, consider the uterotonic drugs, fibrinogen and tranexamic acid, uterine tamponade sometimes, or sutures, okay? Or finally, hysterectomy. This is for the management of the hemorrhage. This algorithm is very important, okay? And you need also to study this. I hope that you find that in your final revision note, this algorithm from the maternal collapse guideline. Okay, my friends, is that clear so far? Okay, so another definition. What is this definition? Okay, I'll tell you. This definition regarding the neonatal death and stillbirth or late fetal loss. Okay, are those important? Yes, they are. Okay, they still ask you these questions in the exam. They just make sure that you have read the MBRRACE or you understand, okay, the report. Okay, so if you open the report, you will find it in the introduction actually. Okay, what is the definition of late fetal loss? This is a baby born between 22 weeks and 23 plus 6 weeks of gestation, showing no signs of life, irrespective of when the death occurred. Okay, guys? So here we speak about the gestational age, not about the baby age. Okay? So let's say a pregnant woman, okay? She came today and she had signs of very early labor, okay? You check her files and you find that she is pregnant in 22 weeks plus 5 days. And unfortunately, the baby is expelled. Okay? When the baby is delivered, there was no signs of life. Okay? What is this called? Is that a neonatal death or that a stillbirth? That's the previous EMQ in 2000, I think 21, maybe 22 as well. What do you think, guys? This is called late fetal loss, between 22 to 23 plus 6 days, late fetal loss. Okay, how about neonatal death? Neonatal death, my friends, is a live-born baby between 20 weeks of gestation or later who died before 28 completed days after delivery. Okay, so the scenario comes as a pregnant woman in her 22 weeks plus 5. She came with signs of very early preterm delivery, and once a baby is delivered, you find that the baby had signs of life. Baby weight is 500, for example, gram, okay, and the neonatal team have tried to do a resuscitation immediately, but after a few minutes, the baby died. What is this? That's a neonatal death. Okay, so dear friends, what is the difference between the neonatal death and the late fetal loss? That when the time of the delivery exactly, plus was the baby alive at that time or not? Okay, so because your college like this game, okay, so they will give you the gestational age between the 22 and the 23 plus 6, and sometimes he will give you in the question that baby born with no signs of life, or sometimes he will give you in the scenario that baby born with some uh, signs of life, okay, after a few minutes in trial of resuscitation, baby unfortunately is dead. So here we will call it a neonatal death. Is that clear so far? Hopefully it is. Okay, so dear friends, what is a stillbirth? A stillbirth is a baby born at 24 weeks of gestation showing no signs of life, no signs of life, irrespective of when the death occurred. Okay, so again, this is about the gestational age. A pregnant woman in 24 weeks of her pregnancy, she came with a gush of fluid, okay, and she progressed fast. You find that she delivered a dead baby, okay, with no signs of life. What it is called? This is called a stillbirth. Okay, even if the baby shows some maceration or signs that this death happened 2 days or 3 days ago, it doesn't matter to you. What you are looking at now is the gestational age. Gestational age, the pregnancy in its 24 weeks, that means it's a stillbirth, no matter when the death occurred. Are we clear so far, guys, between the different definitions between late fetal losses, stillbirth, and neonatal death? Hopefully, it's clear. It's an EMQ which caused some confusion, and if you did not revise this before exam, I'm sorry, there's no way that you can get it right. Right? Okay. And believe me as well, this is something that everybody will forget. So please make sure that you're revising this before your exam, okay? In the morning, for example, just have a quick review to the definitions and difference between them. Okay, so is the stillbirth in the neonate related to any factors? Like, for example, the ethnicity groups? What do you think? It is. Okay, so unfortunately, in Black African babies, the rate of the death is much higher than the white babies, okay, and it's almost fourfold. Okay, so this is related to some facts, like for example that they are living in most deprived areas. Okay, that's mean that they are unfortunately they are disadvantaged. Okay, so this is a fact that came from the MBRRACE, and this fact actually means that the government and the NHS, they need to work, okay, in providing better care to the Black African in the deprived area. Okay, guys. So it's a single best answer question in exam. Another question that came also asking about the rate of death. What is true about the rate of neonatal death? Okay, so guys, the rate of baby death from 24 weeks of pregnancy till from the 2013 till now is remain the same or decreased or increased? What do you think? It decreased. So the true that it decreased. Okay, guys. So again, they give you in this, and by the way, this is just a screenshot from the report. So here the stillbirth is a death occurring before or during birth once a pregnancy has reached 24 weeks. Okay, and the neonatal death is a baby born at any gestation who lives even briefly but dies within 4 weeks of birth or 28 days, and I will increase here that it's exactly from 20 weeks, okay, by the definition. Okay, both together, if you count the stillbirth and the neonatal death together, this is called extended perinatal death. Okay, so last thing that I would like you to take care of is the steps of the neonatal life support. Okay, so again, this is a mandatory training thing. I know that we have discussed this before, but please take care again of the steps. Okay, take care in the exam if the baby show good heart rate, okay, above 60 or less than that, if the baby can breathe or the baby cannot. Okay, so please take care. Okay, so please remember at all times that help is needed, okay, and maintain the temperature, keep the baby warm, okay, and this is during the approximately 60 seconds, what you need to do is start the clock, note the time, dry, wrap, stimulate, and keep the baby warm. Assess for color, tone, breathing, and heart rate. Ensure that the airway is open, okay? And for preterm, consider the CPAP, okay? If gasping and not breathing, then give, if no air, no, gasping or not breathing, B, what you will offer? Will you offer chest compression first or inflations first? Inflation. So give 5 inflations, please, and the pressure should be 30 cm of H2O. Okay, guys, this is if the baby is gasping or not breathing. Okay, so again, reassess. If no increase in heart rate, look for the chest movement. If the chest is not moving, then what you need to do, check the mask, head and jaw position, 2-person support, consider suction, laryngeal mask, and or tracheal tube. Repeat inflation breath and consider increasing the inflation pressure. Reassess. If no increase in the heart rate, look for chest movement. Once the chest is moving, continue ventilation breaths. If the heart rate now, after the chest is moving, is not detectable or less than 60 in the neonate, then after 30 seconds of the ventilation, you need to synchronize 3 chest compression to 1 ventilation. What is the rate again? 3 to 1. Okay, remember this, please. 3 to 1. Increase the oxygen to 100%. Consider intubation if not already done, or laryngeal mask if not possible. Then reassess the heart rate and chest movement every 30 seconds. If the heart rate remains not detectable or less than 60, then ensure the vascular access and drugs. Okay, consider other factors like pneumothorax, for example, or hypovolemia or congenital abnormality. update the parent and debrief the team, and then complete the record. So dear friends, I just need you, okay, please, okay, to print out this document, revise it before your exam, okay? Okay, my friends, would you do that, please? Okay, so this is a little exercise, okay, that I posted to the group today. And in this little exercise, I'm just showing you for cardiac disease, this is indirect cause of death. For VTE, this is direct. Choriocarcinoma related to pregnancy, it's direct. And ovarian cancer, indirect. Breast cancer, indirect. Cervical cancer is indirect. Melanoma or osteosarcoma, for example, is coincidental. And postpartum sepsis is direct, of course. Chorioamnitis is direct. Post-abortion is direct. UTI sepsis is direct. However, COVID-19, for example, or influenza or meningitis are indirect cause of deaths. Suicide is direct. Drug misuse or alcohol is indirect. Okay, a traffic accident or homicides killed by somebody is coincidental. Okay, my friends, I came to the end, okay, of this discussion today. I hopefully that can help you clear one of the topics that can cause headache for you before the exam, easily forgettable. So please take care of yourself, continue on your topics. Please revise the important topics as I have listed for you before, and believe in yourself. You can do it. Guys, you are doing great and you are my champions, and you're going to keep fighting till the last minute of the exam. Okay, please believe in yourself, trust, okay, in your abilities, work hard, and make sure that even the tiniest thing can make a big difference. Okay, good luck, my dear friends, in your exam. Okay, and inshallah, um, Allah is going to give you a reward by success. Okay, and crown all your efforts with the highest rank. Good luck in your exams and your career, and I'm waiting to see you in part 3 exam. Good luck. Bye.